Hey everybody, this is Dr. Lori Langdon, board certified pediatrician, mama of 6 and grandma of 2. And today's topic is gynecomastia. That's a big word, and it just means a benign proliferation of glandular breast tissue in males. Now, in my world of pediatrics, we really only see it twice. The first time is in the newborn period. You may remember this when your kids were first born. Equally affected boys and girls can have breast tissue that responded to the hormones of their mom when they were still in utero. So the estrogens cause that proliferation of the glandular tissue, and you can feel these little buds. It is even possible sometimes in both boys and girl babies that could even make a tiny bit of milk. Do not squeeze it, do not get milk out. That could just lead to a severe infection, and that's a problem. As long as you just leave them alone, those little breast buds of newborns will go away on their own, so don't worry about it. Now, the other big time we see gynecomastia, or this benign proliferation of glandular tissue, breast tissue in males, is in the teenage years or the pubertal years. As you can imagine, for a guy with breast development, they are mortified. So first of all, sometimes you can have pseudo-gynecomastia, which is just fatty tissue. If the child is very overweight, then they could have just fatty tissue there that could look like breast development, but there's no actual nodule. For genuine gynecomastia, just like the initial breast bud in girls, it can be tender. It's located under the nipple area, and it can occur initially on one side or happen on both. So let me remind you, if you're the parent of a girl, that it's totally normal as early as age 8 to 9 to begin seeing those breast buds. They can occur just one at a time and then the second one, and they can be very tender to touch, and they should be located under the nipple. As long as that's the case, we're really not worried. Now, here's the amazing part. Even for the boys, we're not worried. Typically, gynecomastia in boys, or the breast development, can happen and only last anywhere from 6 months to up to 2 years. We start to worry a little bit more after it's been a full year. We certainly would worry if there was drainage, if it was exquisitely tender, if there were streaks of red coming from it. It could be something else, or if there was just tremendous growth, that could be something different. But if it is a sometimes tender nodule under the nipple, then that's probably what we're talking about here, the gynecomastia. What's going on is people don't realize in all the different stages of puberty, both estrogen and testosterone have roles to play in both girls and boys. And so during puberty, at times, the estrogen may have a little bit of a heavier presence than the testosterone, and eventually the testosterone keeps rising and then overtakes it. So for the boys, they lose any breast development that they originally had. I have had some patients with this many through the years, and sometimes they'll try to wear a tight t-shirt under clothes or something to make it less apparent because they're very embarrassed. Now, we do not usually do any kind of medication or any surgery because it's benign and self-limited. That means it'll go away on its own. It does not represent cancer or anything like that. Now, I can tell you that there are certain medications that are associated with gynecomastia. Now, some of the more adult type medications we will see in older gentlemen could cause some breast tissue development. Not usually the case in my population, in the pediatric population, but certainly there are some chemotherapy agents that can cause gynecomastia. There are some antibiotics and antifungals. There are some anti-ulcer medicines like cimetidine and omeprazole. There are all sorts of the cardiovascular meds like statins and antihypertensives, many of them. Lots and lots in that category. So that's often a cause in the older gentlemen. Now, for our age group, for the teenage boys, most of the time it's normal physiologic, just like we said, but there are some substances they could use that could increase their odds of having gynecomastia, so obviously they would want to avoid these. Those things could include tea tree oil and lavender oil. So please, teenage males, avoid those because I know no one wants to have breast development. And then there are also some drugs of abuse. So alcohol can increase the odds of having gynecomastia, so can marijuana use, heroin use, methadone use, and marijuana. Did I say marijuana? So alcohol, marijuana, those are probably the two most commonly used ones, but also heroin and methadone and amphetamines. So important for young teenage males to realize those things. So obviously we don't want you experimenting with alcohol or amphetamines or heroin or marijuana or methadone anyway, but there's another incentive. Those things are associated with a higher risk of gynecomastia or breast development in males. I hope this was helpful. As always, please subscribe, like, and share, and let me know if you have any additional questions you'd like for me to cover.